You know that feeling when you really need to get a handle on something important, but you're just faced with this mountain of information?
Oh, yeah. It can feel totally overwhelming. Where do you even start?
Exactly. Well, that's what we're here for. Today, we're going to dive into a health issue in dogs that can be, frankly, really scary for owners. It's called hemorrhagic gastroenteritis, or HGE for short.
That's right. And we've sifted through the research, what it is, potential causes, the signs, how vets diagnose it, and importantly, the treatments.
Our mission today is really just to give you a clear, focused understanding of HGE, cut through some of that complexity.
So you feel informed, maybe a bit more prepared, without getting bogged down in all the heavy medical jargon.
Okay, let's unpack this then. What is HGE, really? What are we actually talking about here?
Okay, so HGE is basically a very sudden, very severe gut problem, and it's specific to dogs.
Sudden and severe.
Yeah, the technical term is peracute hemorrhagic enteritis. That peracute part is key. It means it happens incredibly fast.
Like out of nowhere.
Pretty much. A dog can seem fine 1 minute and be extremely sick just hours later. The absolute classic sign is explosive bloody diarrhea, often vomiting too.
Explosive definitely gets your attention. So this isn't just like a minor tummy upset.
No, not at all. What makes HGE so dangerous is how quickly the dog loses fluids and electrolytes into the intestines.
Right.
This causes a really rapid drop in blood volume, this is called hypovolemia, and a significant thickening of the blood because the fluid part is lost. We call that hemoconcentration.
Okay, so the blood gets thicker.
Exactly. Imagine it becoming sludgy. That makes it harder for the heart to pump, harder for oxygen to get where it needs to go. These two things, the hypovolemia and hemoconcentration, are really distinct features that help vets differentiate HGE from other things that cause bloody diarrhea.
Okay, that makes sense. Such a dramatic onset. What's actually going on inside the dog's gut to cause this sudden breakdown?
Well, it's fascinating and pretty alarming. The lining of the intestines, the mucosa, it just rapidly loses its integrity.
Like a barrier failing.
Precisely. It becomes leaky almost instantaneously. And this lets blood, fluid, vital electrolytes just pour into the gut lumen, into the intestines.
Which explains the rapid fluid loss.
Exactly. And as we said, that quickly leads to dehydration and potentially life-threatening hypovolemic shock.
Yeah.
There's also a risk that bacteria or their toxins can cross that damaged barrier.
Oh, so it could get even worse, like sepsis.
Yeah, potentially leading to septic or endotoxic shock. It adds another layer of danger.
Wow. So if a pathologist looked at the tissue, what would they see? Is it inflamed?
That's a key point. Microscopically, they'd see what's called superficial hemorrhagic necrosis, basically. Surface tissue death with bleeding. But crucially, there's usually not much inflammation.
No inflammation. That's surprising.
It is, and it's one of the distinguishing features. Also, interestingly, the stomach lining usually looks completely normal. It's mainly the intestines.
Okay. So who tends to get this? Can any dog get HGE or some more susceptible?
Well, it is specifically a dog condition. And while technically any dog, any breed could get it, we definitely see it much more frequently in small and toy breeds.
Ah, the little guys. Any particular breeds?
The research often points to miniature schnauzers, dachshunds, Yorkies,
My sister has a Yorkie. Sorry.
okay, and miniature poodles. Those seem to be the most commonly represented breeds.
Interesting. Why them? Do we know? Any theories?
You know, the sources don't really speculate much on the why for those specific breeds. It's more an observation of incidence.
Fair enough. What about age? Puppies, older dogs.
It generally hits adult dogs. The average age is around 5 years old.
Okay, middle-aged.
Yeah. And there's no known difference between males and females. No sex predilection, as they say. It's also considered a pretty common thing vets encounter.
Right, so let's say you have one of these commonly affected breeds, an adult dog. What are those first warning signs? What should you, as an owner, be looking out for?
Well, the presentation can vary a little, sure, but it's almost always that peracute onset really sudden.
Right, the speed.
And most of these dogs were perfectly healthy, like just hours before. The first things you might notice are acute vomiting, sudden loss of appetite.
Just stops eating.
Yep. Stops eating, maybe seems really tired, lethargic. Then that quickly progresses to watery diarrhea.
And then the blood.
And then very quickly that diarrhea turns bloody, really bloody.
How quickly are we talking here? Hours.
Yeah, often within maybe 8 to 12 hours, those initial signs can escalate dramatically. That's because of the rapid fluid loss and the blood thickening. We talked about the hypovolemic shock setting in.
So if you get the dog to the vet, what might they find on examination?
They'll likely see the lethargy, the weakness, maybe their gums look pale or take a long time to turn pink again if you press on them. That's the prolonged capillary refill time, showing poor circulation.
Okay.
Pulse might feel weak too.
What about the classic dehydration signs like skin tinting?
That's a good question. Because it happens so fast, sometimes those typical signs of dehydration like poor skin elasticity aren't obvious right at the beginning.
Okay. That's tricky.
It can be. The vet might notice the abdomen seems painful when touched, or they might even feel fluid-filled loops of bowel.
And you mentioned something distinctive about the stool earlier.
Yes, later on, a really characteristic sign develops on a rectal exam. The stool often looks like raspberry jam.
Raspberry jam. Wow, that's vivid.
It is. Very dark, jelly-like, extremely bloody. And another interesting thing, you might expect a fever with something this severe, right?
Yeah, absolutely.
But often the dog's temperature is normal, or sometimes even low, especially if they're going into shock.
Okay, that raspberry jam description, definitely memorable, though not something you want to see. Let's shift to the cause. It sounds so aggressive. Why does this happen?
That's the million-dollar question, honestly. The precise, exact cause of HGE is still, well, it's unknown.
Really? For something seemingly common?
Yeah. Researchers have looked into allergies, autoimmune problems, various infections, lots of theories.
But nothing concrete.
Well, there's increasing evidence pointing towards a bacterium called Clostridium perfringens, specifically type A and its enterotoxin.
Clostridium. I've heard of that.
Right. This toxin has actually been found on the damaged gut lining in affected dogs. So the thinking is shifting a bit.
How so?
It might not be a simple infection in the traditional sense. Maybe it's more about an imbalance in the gut environment that allows this Clostridium to overgrow or produce more toxin, contributing to the damage. It's a big area of research right now.
So Clostridium is involved, but it's complicated. Are there known risk factors then? Things that make it more likely?
That's another tricky part. There are no clearly defined risk factors.
Mm.
Like we said, most dogs that get HGE were perfectly healthy beforehand. It seems like some unknown trigger causes this abnormal, massive response in the gut.
Which might involve Clostridium.
Exactly. Might involve Clostridium, but we don't just treat it like a standard bacterial infection you'd give oral antibiotics for, because the main immediate problem is that severe gut damage and massive fluid loss.
Yeah. Right, that makes sense. Focus on the immediate crisis. So, if a vet suspects HGE, how do they confirm it? What's the diagnostic process?
Diagnosis is largely about ruling out other things that look similar.
Like what?
Oh, things like parvovirus, especially in younger dogs, or maybe a foreign body stuck in the intestine, pancreatitis. Other serious gut issues.
So elimination first?
Pretty much. And blood work is absolutely critical here. The standout finding, the hallmark in HGE, is that significant hemoconcentration.
The thick blood.
Exactly.
Yeah.
The packed cell volume, or PCV, is often really high, maybe over 60%, sometimes even higher. Normal is more like 35–50%.
Wow, that's a big jump.
It is. And interestingly, the protein levels in the blood might be normal or even low.
Why low?
Because protein can also leak out into the damaged gut along with the fluid. You also usually see what's called a stress leukogram in the white blood cell count.
Meaning?
It's just a specific pattern of white blood cell changes that indicates the body is under major physiological stress, which definitely fits with HGE.
Okay. What about other tests, stool samples?
Yeah, fecal tests are important mainly to rule out other causes. You'd expect tests for parasites and parvovirus to be negative.
Right.
Looking at the stool under a microscope, fecal cytology will just show loads of red blood cells, as you'd expect.
And the Clostridium, can you test for that?
You can culture Clostridium from the stool, but that's not very helpful on its own because lots of healthy dogs have it in their gut normally.
Ah, okay.
However, there's an ELISA test that specifically looks for the C. perfringens enterotoxin in the feces, and that test is often positive in HGE cases.
So the toxin test is useful, but just finding the bacteria isn't.
Exactly. And just doing a PCR test for one specific toxin gene, the alpha toxin gene, isn't enough for diagnosis either. Oh, and clotting tests are usually normal.
What about x-rays or ultrasound? Can they see the damage?
Imaging can be useful, mainly, again, to rule out other problems like a blockage.
Okay.
On X-ray or ultrasound, you might just see that the intestines, both small and large, look kind of distended with fluid and gas. It's not usually specific for HGE itself.
And endoscopy, putting a camera in.
Rarely needed for diagnosis. If you did do it, though, you'd see widespread bleeding, maybe ulcers, and just generally angry-looking hyperemic tissue throughout the intestines.
Got it. Any other tests?
Sometimes an ECG, Monitoring the heart's electrical activity might show some arrhythmias, possibly related to the shock or electrolyte imbalances. But ultimately, if you were to biopsy the tissue, which again you wouldn't normally do, the key finding is that congestion and tissue breakdown without lots of inflammation.
Okay, so the diagnosis comes together from the history, the signs, ruling out other things, and especially that super high PCV on the blood work.
That's a good summary, yeah.
So a dog gets diagnosed. It sounds critical. What's the treatment plan? What do vets do?
You hit the nail on the head. It is critical. So immediate aggressive hospitalization is absolutely essential. These dogs can go downhill so fast.
Time is really of the essence.
Absolutely. The number one priority, the cornerstone of treatment, is rapid, aggressive intravenous fluids.
Pumping fluids back in.
Exactly. Using balanced electrolyte solutions, often starting at a really high rate. The initial goal is to get that dangerously high PCV back down below 50%.
Flush the system, basically.
In a way, yes. Rehydrate and dilute that concentrated blood. Once the PCV starts coming down, they adjust the fluid rate to maintain hydration and correct any electrolyte problems, like low potassium, which is common.
Okay. So fluids, fluids, fluids.
Pretty much. And they also have to estimate any ongoing losses, like if the dog is still having diarrhea, and replace those fluids too.
What if the protein level is really low, like you mentioned?
Good question. If they're significantly hypoproteinemic, the vet might use colloid special fluids with larger molecules that help keep fluid inside the blood vessels or maybe even plasma transfusions in severe cases.
And what about letting the gut rest?
Essential. During the acute phase, the dog will have restricted activity and be kept NPO nothing by mouth. No food, no water initially.
When can they start eating again? Owners must be anxious about that.
Oh, definitely. Usually once the vomiting stops and they start showing improvement, often within the first 24 to 48 hours, food is reintroduced very gradually.
What kind of food?
Typically a bland, highly digestible, low-fat, low-fiber prescription gastrointestinal diet. They stay on that for several days before slowly transitioning back to their normal food.
Any long-term diet changes recommended?
Sometimes. There's some thought that maybe increasing dietary fiber long-term could help modulate the gut bacteria, potentially reducing the risk of recurrence, especially if Clostridium is playing a role. But that's more of a consideration after recovery.
What about medications? Antibiotics?
Even though it's not seen as a primary bacterial infection, parenteral antibiotics given by injection, not pills, are generally recommended.
Why?
Mainly to cover the risk of bacteria crossing that damaged gut barrier and causing a secondary infection or even sepsis. Something like amoxicillin combined with sulbactam is a common choice.
Okay. Any other meds?
Definitely anti-nausea medications, like meropenem, to control vomiting. Often antacids are given intravenously too, like famotidine or pantoprazole, to help protect the gut lining.
Blood transfusions.
Very rarely needed, thankfully.
And what about things not to give?
Right. Oral antibiotics generally aren't the first choice. Things like Pepto-Bismol or Kaopectate intestinal protectants aren't usually recommended in the acute phase, nor are antidiarrheal drugs like loperamide. They can sometimes make things worse.
Probiotics maybe later on.
Yeah, some vets might consider adding probiotics during the recovery phase, once the dog is stable, to help reestablish a healthier gut microbiome.
Okay. So how does recovery usually go? What's the timeline?
Well, they need really close monitoring, especially checking that PCV and the total protein levels frequently to guide the fluid therapy.
Making sure the fluids are working?
Exactly. If a dog isn't showing significant improvement within, say, 24 to 48 hours, the vet team really needs to step back and reconsider. Is there something else going on? Did we miss something?
Are there common complications to watch for?
With prompt, aggressive treatment, serious complications aren't super common, but they can happen. Things like DIC, a severe clotting disorder, or neurological signs, even seizures, sometimes related to the thick blood. Cardiac arrhythmias can pop up. And very rarely, a kidney issue called hemolytic uremic syndrome.
Sounds serious. But usually the outcome is good.
Usually, yes. The actual course of illness is often surprisingly short, maybe just 24 to 72 hours of intensive care. With the right treatment started quickly, the prognosis is generally good. Mortality is low in treated dogs.
That's reassuring. Any chance of it happening again?
Unfortunately, yes. There is a chance of recurrence in some dogs. We don't fully understand why some dogs get it again and others don't.
Okay, so let's try to wrap this up. HGE. It's sudden, it's severe, it hits the gut hard in dogs. That key sign is the explosive bloody diarrhea, maybe looking like raspberry jam later on.
Right, and the diagnosis often hinges on ruling out other stuff and seeing that really high PCV, that hemoconcentration, on the blood work.
Cause. Still a bit of a mystery, though Clostridium perfringens and its toxins seem involved somehow.
Yeah, the exact trigger is elusive, but the treatment is clear. Immediate, aggressive vet care, especially IV fluids.
It,
That's absolutely paramount.
it really highlights how critical prompt action is for a positive outcome.
Definitely. Understanding just how fast this thing can move and how dramatically it affects the dog's body,
Yeah.
that's crucial knowledge for owners and vets alike.
That really clarifies things. It takes a scary, complex condition and makes it much more understandable. So here's a final thought for you listening.
Mm-hmm.
Given this likely role of gut bacteria, like Clostridium, in HGE, this sudden dramatic illness, what other health issues, maybe ones that seem to come out of nowhere, in animals or even in us, might have these intricate, perhaps still hidden connections to the trillions of microbes living inside us?
That's a fascinating question. It really makes you think about the gut microbiome, doesn't it? This incredibly complex internal ecosystem and how much we're still learning about its influence on, well, pretty much everything related to health and disease.
Yeah.
Makes you wonder what else is waiting to be discovered there.